Hi everyone, welcome back to my page. Today we'll be talking about vaginal itching and the causes of vaginal itching and how they can be treated. Please, if you are new to my channel, my name is Dr. Nkiruka Bridget. I'm a consultant obstetrician gynecologist. I discuss everything about women's health, children's health, and sometimes men's health on my channel. If you're not following me on Facebook, follow me at OBGYN Talks with Dr. Dazayon. Subscribe to my YouTube page at Dr. Nkiruka Bridget at OBGYN Talks with Dr. Dazayon. I'm on Instagram and TikTok with the same name. So welcome to my page. Let's go on with the discussion. Vaginal itching can be caused by a lot of things, depending on what the individual is having. Some people call the outer part, which is the vulva, also vaginam, and some also call everything about the reproductive part vaginam. However, the genital tract of a woman is divided into the vulva, that is the outer part, the one that you are seeing, the one that contains the clitoris, the labia majora, the labia minora. Then inside is the vaginum. That is the vagina introitus. Inside is the vagina. Then from the vaginum you get to the cervix, then the uterus, and then the upper part of the genital tract. So when you start having itches and scratches around the vulva or inside the vagina, I mean inside, most people call it vaginal itching. So I'm going to use the term together. I will not say vulva itching or vaginal itching. I'll be using vaginal itching for both the vulva and the vaginum. So causes of vaginal itching can be from anything, and finding the cause or whatever it is, whatever that is causing it, will help prevent and help treat the individual. Vaginal itching can actually be uncomfortable for the person experiencing it. Imagine walking on the road and down below is actually scratching you and you don't even know what to do. In the presence of everybody, if you try to scratch it, you may actually disgrace yourself. So it can be uncomfortable. It can cause a lot of embarrassment to whoever that is been experiencing vaginal itching. So that's why I'll be discussing it today. Stay tuned with us. If you have not subscribed, please hit the notification button, subscribe to my page right now. Now let's go on. Causes of vaginal itching can be from irritants. Taking from irritants, there are a lot of things that women use that their body may be allergic to. For example, do you know that soaps can cause vaginal itching? If your body is allergic to a particular soap that you are using, when you use the soap to wash your vulva, you may have what we call contact dermatitis. Your body will start reacting to the content of that soap and may lead to itching. From that itching, it can swell up, it can even be reddish and painful. So a soap that someone is using can cause vaginal itching. Shower gels can cause vaginal itching. Bubble baths can cause vaginal itching. Anything that you apply around that place that your body is not accepting can actually lead to vaginal itching. Another things that can cause irritants around your vagina include urine. So, some women that have some conditions known as vesicovaginal fistula or anything that causes stress incontinence. Stress incontinence means that your body cannot hold urine, that in a small thing, the urine will just pop out. And if it irritates that place and you leave the undies for a long time, it can cause dermatitis around that place, reactions, irritations around your vulva, and you may start scratching. So these are the cause of irritant vaginal itching. Irritation, it just means something coming in contact to your skin and causing irritation around your skin. Some even spray scented spray around the vagina. I know that we want to keep that place clean, but however, applying things there will not actually keep it clean. What keeps it clean is wash just your vulva and leave it dry. Leave it dry. Let your undies be cotton. Let your undies not be nylon. Do not use one undies for a long time. Anytime you remove your undies, try as much as possible to replace it. I mean, anytime anything makes you to remove your undies for any reason, do not rewear that undies. That undies must be discarded and washed, and you put on a new one. This will help you not to have irritation around that place and prevent vaginal itching. Other things that can cause vaginal itching or vulvar itching, let me just use vaginal itching, include latex condom. There are different types of condoms that can be used for contraception, different types of condom that can be used for intimacy. One of them is latex. Some women react to latex. Just a latex touching their body or touching around that place will give a bad irritation that will now see redness, swellings, and pain, and severe scratching. So, latex condom can cause irritant or vaginal itching for some women. So you find out if you are the one that reacts to condom, maybe after intimacy, and you find that you are scratching because of the condom use. Check the condom that is being used. Other things include douches. I've discussed before, you're not expected to douche. Douching, that is washing inside your vagina. Put your hand inside to wash, does not make it clean. What you're actually doing is that you are disrupting the ecosystem. The ecosystem inside the vagina, nature has made it so balanced that we have the good and the bad bacteria living together. So for whatever reason that makes you to douche, that is putting your hand inside to wash, may cause vaginal itching, because you are going to disrupt, removing some bacteria that form normal natural ecosystem, making them to live in equilibrium. So if you douche, you remove some good bacteria and the bad one may overgrow, and the person will start itching, may start having vaginal discharge or even fast swelling vaginal discharge and severe itching that will embarrass you. So douches, there are some other people that say things that are called douches in the supermarket. Don't take anything to use and wash your vagina. Your vagina, I have said, is actually self-cleansing. If you douche, you may have vaginal itching. Then others include scented pads and linens. Some women will, in fact, just have said, let us not use whatever that is scented around our vulva or vagina. Please use the normal pad. Not some of them that are scented may cause irritation because of the alcohol or the spray, the deodorant that inside the pad you are using. It may lead to vaginal itching. Linings, pipe liners may also cause vaginal itching, especially if they have abnormal things like what your body does not want. So you find out what the cause of your vaginal itching is, you remove it so that the irritation will stop and your body will heal. Then others include spermicide, some topical contraceptives. Some women after intimacy may not want to get pregnant and they will use topical spermicide to kill the sperms. Some people's nature or natural body does not accept this, and the body may start reacting to the spermicide and the person will have vaginal itching around that place. Then other things are some scented toilet papers. This can cause vaginal itching. Remember, they are not just pure. They are impregnated with deodorant. Some of them are impregnated with alcohol. And remember that the part around your vagina is so soft. And anything, not just like your normal skin, it is softer. It is made up of mucous tissues. So anything that enters there that is not supposed to enter there, that is not just quite natural, may cause irritation around that place and you present with vaginal itching. So what if you find these as irritants and you stop them, it may stop the vaginal itching. Other causes of vaginal itching by causing irritation includes things like cream, detergent, ointment, lotion. Rub these things on other parts of your body. Please leave your vulva or vaginal area alone. Don't apply talc powder on your vagina. It may actually cause irritation and the person will have contact dermatitis and have vaginal itching. It may not just be vaginal itching, it may go on to have redness, swelling, and abnormal vaginal discharge. So they are not necessary applying these things or on your vulva or trying to make it smell nice. Remember that I said initially before now in other videos that the vagina has its own scent. Allow it to be. It shouldn't be foul smelling. It has its own natural odor and you shouldn't go to disrupt that, because whatever you are trying to use to disrupt that may cause contact dermatitis and will lead to vaginal itching. Now, these are other skin conditions in the body can actually affect the vaginal area. Things like eczema, psoriasis. If they are in other parts of the body, it may actually cause itching in the vagina, because you remember the vagina is part of your body. So if you're having some skin disorders that are causing itching, severe itching, they may also cause severe itching in the down below in your vagina. So these things are other causes of vaginal itching. Then we'll have yeast infection. Remember I've discussed before, douching. I'm going back to washing your vagina. Anything that will cause an overgrowth of the fungus or the organism, especially candida, can actually lead to vaginal itching. So yeast infection can happen leading to vaginal itching. Inside the vagina, the yeast and other bacteria are living together in equilibrium. So if there's anything that actually causes disruption of the bacteria, causing increase in the growth of the yeast infection, the person will actually come with vaginal itching. And what could this be? If someone has used prolonged use of antibiotics, they've been taking antibiotics, remember the antibiotics is actually acting against the bacteria and not against the yeast, the fungi. So the fungi may overgrow and cause vaginal itching for the individual. So anything that causes you to have overgrowth of the yeast infection may lead to vaginal itching. Now, people that douche, when you wash inside your vagina, you may disrupt the ecosystem, and the cervix and the vaginal equilibrium will not be overgrown by yeast infection like candida infection. The person will come with vaginal discharge, thick whitish cord-like vaginal discharge with severe itching, redness. So these are causes of yeast infection, and they may lead to vaginal itching. Now, if someone that has immunosuppression for any reason, uncontrolled diabetes, pregnancy, HIV virus, that is anything that causes immunity depression, may lead to overgrowth of the yeast infection, and the person may come with vaginal itching. So yeast infection can cause vaginal itching. Then we have another cause, which is bacterial vaginosis. Bacterial vaginosis is a group of bacteria that causes vaginal itching, causes vaginal infection actually. So it is also part of those organisms that collaborate with other organisms in the vagina to live peacefully and make the vaginal ecosystem very healthy and rich. If anything disrupts it, you will not have excessive growth of one or the other, and the person will come with bacterial vaginosis. The person will have fishy, smelling, thin vaginal discharge that is abnormal and might lead to chronic itching. So these are the causes of vaginal itching that can be from either yeast or fungal infection or ordinary bacterial infection. So overgrowth of any of them may lead to vaginal itching. When this itching is associated with abnormal vaginal discharge that is smelling, it is time for you to seek medical attention. Others include sexually transmitted infection. Sexually transmitted infection, which include chlamydia, trachomatis, gonorrhea, genital warts, genital herpes, trichomoniasis. Any sexually transmitted infection can lead to vaginal itching, with other things like vaginal discharge, vaginal sores. You may have blisters around the vulva, maybe from sexually transmitted infection. Chlamydia infection is sexually transmitted. Gonorrhea is sexually transmitted. Genital warts, mostly from human papillomavirus. And as the wart is growing, you start seeing florid things that are like flower growing on the vulva. It may lead, or it's been inside the vagina, it may lead to vaginal itching. Then trichomoniasis, the person is scratching. They are like pins. There are worms in the vagina. They are scratching. It's a bacterial organism though. The person is scratching, and the scratching is not stopping. From that scratching may lead to redness, and even ulcers may develop around that place. These are sexually transmitted infection can lead to vaginal itching. So other things I will not fail to mention is pubic lice. These pubic lice are also known as crabs. It can be gotten from sexual intimacy, not just from sexual intimacy. That is contact with the pubic hairs of your partner who has pubic lice may give you pubic lice. And those pubic lice, 5 days after infestation, the person will develop vaginal itching. The person will be scratching, and it does not stop. At the point of that scratch, you will see a dark bluish spot. So it's a sign that there is pubic lice. It can also be gotten from beddings, using the same beddings or using the same towel. So it's advised that you have your own towel. Peradventure, there is pubic lice, someone that you are sharing towels with, the person will not give you the pubic lice. These are the causes of vaginal itching. Others that can cause vaginal itching include menopause. When someone has reached menopause, that is, you have stopped seeing your period, everything about ovulation, reproductive system is going down, the person's estrogen level declines, it goes down. Estrogen is what actually keeps the body of women succulent. It keeps us moisturized. So when the person has reached menopause, is about to reach menopause, the estrogen level begins to decrease. The person will start having thin vagina that is not elastic and very dry. So the dryness will cause itching. So the person may come with vaginal itching. It's actually from the effect of menopause. Then other things include stress. Someone that is so stressed may have vaginal itching. You know, the level of cortisol, that cortisol increases immunosuppression, and that immunosuppression will not lead to the person having increased susceptibility to infection, and the person may come with vaginal itching. No infection in the vagina causing vaginal itching. So stress level should be reduced as much as possible. Then another thing, though rare, is vulvar cancer, but it still happens to people. It may start with a pin, a nodule that is scratching, itching the person. It is, if you see such a thing, the person should seek medical advice and look for a gynecologist so that those shall be examined and be sure that it's not vulvar cancer. Vulvar cancer can actually lead to vaginal itching. So these are the causes of vaginal itching. If you have not subscribed to my YouTube channel, please subscribe to my YouTube channel at OBGYN with Dr. Dazayo. Follow me on Facebook page, TikTok, and Instagram at the same name, OBGYN with Dr. Zion, for more medical information. So thank you for watching to this point. Let's go on. Treatment depends on what is found. When someone presents with vaginal discharge, you try to look at, what is the cause? Is this cause from irritation? Find out what's causing the irritation. Is it the soap? Is she, what type of soap is she using? Some people are just allergic to a lot of things. So allergy on the person's skin is not the person's fault. It's from her mast cells. So if you find out that the person is allergic to this, you stop the soap. Whatever that is causing that dermatitis, the inflammation of the skin, it is stopped so that the body can stop reacting to it, and the irritation goes down, the vaginal itching stop. If it's scented pad, you stop. If it's ointment, cream, lotion, you stop. The person is advised to stop those. Whatever that is causing, if it's femicide, it is stopped so that the person can go on to live a normal life and the vaginal itching stops. So if it's sexually transmitted infection, it is treated. The person is treated for the sexually transmitted infection and advised how to protect herself from getting the infection that causes vaginal discharge again. If it's overgrowth of fungi, if you're on prolonged antibiotics, you stop it and advise you to stop. If it's douching, you stop douching. If it's immunosuppression, you are advised on how to boost your immunosuppression. However, we treat the organism either with topical antifungal, insertional antifungal, or oral antifungal. If it's bacterial vaginosis, we give you antibiotics. But this depends on the discretion of the gynecologist you are seeing. So depending on what is found, these things can be treated. Now, when do you seek medical attention? For someone that's having vaginal discharge, there are times you seek medical attention. Most vaginal itching does not give concern because it may just come now and it doesn't happen again. But if it's persistent, frequent, and does not stop, even especially at night, it makes you not to do your normal duty, the person is advised to seek medical attention. If the vaginal discharge is associated with, if the vaginal itching is associated with abnormal, unusual vaginal discharge that is foul smelling, please seek medical attention because it can be another thing. If the vaginal itching is associated with pain, severe pain or tenderness around your vagina, seek medical attention. If the vaginal itching is associated with redness, seek medical attention. Thank you for watching to this point. If you have not subscribed, please subscribe, follow me, grow my page. God bless you. See you next time for more medical tips. Thank you. I remain Dr. Nkiruka Bridget at OBGYN Talks with Dr. Dazayo. See you next time.